Hi, everyone. My name is Dr. Karina Kaplan, and I'm the founder of this blog, My Gut Matters. And due to the technical difficulties, we're moving to Zoom and recording this gut health chat, not really gut health, but health chat. And I will be posting it on so everyone could listen to what we've been talking to. So here with me, I have Dr. Mariya Petrova, who is an expert in vaginal microbiome. She has a Ph.D. from bioscience engineering, and she's been doing a lot of research in probiotic field, specifically with lactobacilli. So thank you so much, Dr. Mariya, for coming. And please tell us a few words about yourself. Thank you.
Hi, Karina. Thank you very much for having me. It's really a pleasure to be here, and hopefully now the Zoom will work and everyone can hear me afterwards. Just a little bit more about myself, like you asked me. I actually graduated both my bachelor and master degrees back at home. I'm originally from Bulgaria. Shortly after I finished my master, I started just from 9 to 5, but soon realized that this is not really for me. I really wanted to focus on research, and I wanted to study everything on molecular level and how things work. That's why I started my PhD here in Belgium, in the University of Leuven. It's actually one of the biggest universities and one of the very good ones here in Europe. My focus was, like you said it, mostly focusing on probiotics and beneficial bacteria and how they can maintain women's health. Because we know how bacteria, lactobacillus, can prevent viral bacterial pathogens. Lately, I have been also involved in one and only conference focusing on women microbes and women-specific microbiome niches. The conference is known as Women and Their Microbes, and we are happy to launch our 4th edition in March 2019.
That's super exciting. Yes, thank you. Thank you so much for introduction. And yes, I'll definitely share more information. You can share more information about this coming conference. So tell us a few words about microbiome. What is microbiome?
Yeah, actually, maybe a lot of people know by now what is microbiome, because it's a word that we hear on a daily basis, either from our newspapers or from so many blogs. So I think a lot of people maybe know what is it, but it's always good to remind to everyone what microbiome is. So microbiome are all microorganisms which are present on your body and live in your body. There are around 100 trillion microorganisms. They are beneficials and they are living symbiotically with you. So 95% of these bacteria are present in your gastrointestinal tract, and you really the universe for them. So if you imagine your body as a Milky Way, you can count more bacteria on your body than stars actually present in the real Milky Way. So these are amazing bacteria living with you, helping you on a daily basis, maintaining your health, sometimes causing a disease, but generally the microbiome should be beneficial for your health and for your well-being.
Yes, thank you. It's impressive. I know a lot of people are still trying to, digest this information, and they can't. Even a lot of doctors, MDs who I talk to, they just can't. They can't understand that. It's hard to imagine that there are so many microbes everywhere in us and on us. So you said there are so many microbes in us and on us. So where predominantly can we find those bacteria? Which parts of our bodies?
Practically everywhere. Whatever you think as part of your body is probably dominated by bacteria, or they form bacterial communities. Maybe we don't know everything yet, but what we know so far is that there is a well-defined community types in your mouth. Gastrointestinal tract, for example, like we already said it, 95% of bacteria are in your gastrointestinal tract. The skin, of course, is one of the major organs that face the environment. It's also populated by a lot of bacteria. Even the acne, it's caused by bacterial infections on your skin and your face. And of course, the urogenital tract for women, the vaginal niche, it's also highly diverse. It's highly populated by bacterial communities. So you can find them practically everywhere you think about it.
Mm-hmm. So, yes, I know. And there was this recent paper just a few days ago where scientists found microbes in the brain too. So, I know there's a lot of speculation, but literally they probably are present everywhere to some degree, right?
Yeah, I just think sometimes we have to be a little bit more cautious with such studies because they are dealing with a low biomass. So it's very difficult to say whether it's really a bacterial dominance and whether they really live in there or it's just maybe a contamination mistake in the research. We always have to take those things a little bit with more caution.
Yes, I agree. So what is vaginal microbiome? We're here to talk about vaginal microbiome today. So tell us a few words about that one.
So the vaginal microbiome, it's a little bit different, let's say, that way from the gut microbiome. And I guess a lot of people actually hear a lot for the gut microbiome, how diversity is the main issue, is the main beneficial role for the human, because the gut microbiome, as diversities, as better health provides for the human host. The vaginal microbiome is just the opposite. We don't want a diversity in our vaginal niche. We would like to have a low diversity, which means that we only rely on a few bacterial species. And for most of the women, these few bacterial species are actually lactobacillus species. These lactobacillus species are able to produce a lot of lactic acid. This is a normal metabolite for them. And thanks to the production of lactic acid, the pH in the vaginal niche is very low. This low pH prevents the growth of bacterial pathogens and has also antiviral effect. So it's important to have this low diversity, lactobacillus dominated niche so you can prevent number of sexual transmitted diseases or just development of other common bacterial infections such as bacterial vaginosis or aerobic vaginitis.
Okay, yeah, that's very interesting.
Yeah, it is actually. The lactobacillus dominated niche, it's considered and it's still considered by the researchers as a healthy niche and a healthy woman.
Okay, so are there particular lactobacillus species? Are they the same as you would find in the gut, or are there completely different species that are very specific to vaginal microbiome?
Well, there is a few vaginal community types. That's how we used to say them in the field of vaginal microbiome. With community types dominated by Lactobacillus crispatus, Lactobacillus gasseri, and Lactobacillus jansseni. Some of them can for sure be found in the gut, but in a very low amount. In the vagina, they're really, like I said, dominant, and they are found in very huge numbers. Other commonly found species actually in the vaginal niche is Lactobacillus iners, but at the moment this is a little bit more a controversial species because scientists are not yet sure what's the exact role of these species in the niche. This is mainly because the strain has a very small genome. It's explicitly and only found in the vaginal niche, so it's almost not found anywhere else on the human body. But on the other side, produce a moderate lactic acid, so it's not a lot of production of lactic acids, which make the species a little bit more protective in the niche. For example, Lactobacillus crispatus, gasseri, and jansseni produce quite a lot of lactic acids, and they are considered as more beneficial. Lactobacillus iners produce less lactic acids, and it's commonly found also during bacterial vaginosis. I guess we will talk a bit about bacterial vaginosis later. It's also found in this type of transitional microbiome when women are trying to recover from BV and transfer back to a healthy state. So we still have a question about this strain. I guess we still have a lot of work to do. But this strain, this species, it's mainly found in the vaginal niche. It's really well adapted for the niche. it has all the machinery to live and survive in the vaginal niche.
Okay, that's very interesting. Thank you. Do you think there maybe there are other genes on his genome, and it would play maybe a different role in the health of the vaginal microbiome?
Yeah, there is a controversial gene related with Lactobacillus iners. It seems that the species can produce interolysin, which can lyse epithelial cells and mucus.
Okay.
Interolysin normally shows similarity with other vaginolysin, for example, a molecule that is produced by Gardnerella vaginalis, and this species is really typical for disease state. So these two molecules show the same similarities, and that's why a lot of researchers actually try to claim that iners is not beneficial, but it's rather pathogenic in the niche. I believe we need more studies to be able to say that. I would not like to claim a species as beneficial or as pathogenic without having all the information and without having the appropriate clinical studies and appropriate wet lab tests, really the people studying molecular basis of the species.
Okay, yes, I agree with that. So do you think women in general, they have very similar vaginal microbiomes, so they have different microbiomes? And what is, a healthy, is there a particular healthy composition, for example?
Yeah, thank you for coming up with these questions. Actually, I wanted to go in that direction as well. Well, it's very difficult to say because it seems that depending on ethnicity, women have a different microbiome. Like till now, we talk mostly about Lactobacillus crispatus, Gasseri, and Yersinia, those beneficial species because we accept them as beneficial. They are mostly found in Caucasian women and Asian women as well. This is a very nice study that was performed in 2011 by Jacques Ravel, and it's already published. On the other side, in the same study, they discovered that Lactobacillus iners dominated microbiota. It's mostly common for Afro-American women, together with a type of more diverse microbiome. Diverse in a sense, women are still healthy. They don't report any symptoms, but at the same time, their vaginal microbiome, it's not Lactobacillus dominated. It's really diverse. You can find many different species that most of the time resemble PV. So there seems obviously to be some kind of difference between women, mostly driven by ethnicity and probably some host factors. So we cannot say per se this dominance of this lactobacillus is healthy and this is unhealthy. I think it's really depending of the women itself and whether they show some kind of symptoms of the disease or they feel healthy.
Okay. Well, that's interesting. I didn't realize that there was a difference in different ethnic groups.
Yeah, there is. Yeah, and actually, it's not only these studies by Jacques Ravel in the United States. There is also a few studies coming out from Africa, studies coming out from Europe, showing indeed changes and difference in the vaginal microbiome in different ethnic groups. Like African women are mostly dominated by Lactobacillus iners and these diverse type of microbes. European and Americans, Asian people are mostly dominated by Crispatus, Gasseri, and Yersinia. So there is clearly a difference. Still cannot explain based on what is this difference that we observed.
So do you think that maybe other factors like diet and geography and environment could also play a role in the composition of vaginal microbiome?
It can be. We just don't know how. It's possible. There is definitely some host factors which we don't know on what basis they steer the community in the niche. We need more studies, definitely.
Okay.
We are far from understanding how microbiome really functions and provide health for the host.
So, do you think the vaginal microbiome, or do you know, based on the research, vaginal microbiome, is it stable throughout different ages and maybe cycle? Women have hormonal cycles, etc. So, do we have the same type, the same composition of the vaginal microbiome, or does it differ?
Yes, nothing is actually stable. I think bacteria change in your body on an hourly and daily basis. Also, in the gut bacteria, depending what you're eating, the composition of the gut microbiome can change. Vaginal microbiome, it's no difference. Like we already discussed, ethnicity is a major factor influencing your vaginal microbiome. Age and hormonal imbalance can also really change your microbiome. For example, women that are in reproductive age are mostly dominated by lactobacillus species, one of the beneficial ones that we already mentioned, while women which are in menopause tend to have a little bit more diverse microbiome. So the lactobacillus are slightly reduced, and they leave place for a little bit other species, which makes the microbiome a little bit more diverse. Pregnancy also can affect your microbiome. Very typical for pregnancy is that the microbiome is extremely stable, so it's not so easy to change from day to day. Menstruation, like you said, a very good point, can also affect your microbiome. In general, during menstruation, your microbiome also become a little bit more diverse. The lactobacillus are slightly reduced, but after the menstruation, the microbiome go back to normal, go back to lactobacillus dominated. So in general, the microbiome is resilient. It will always try to go back to the initial state, hopefully lactobacillus dominated. But there is indeed a lot of factors that can influence your vaginal microbiome, and you should take good care for the factors that you can take in your hands. I understand that age and hormones and menstruation is something you cannot control, but there is other factors that you can actually try to control and keep a healthy vagina, actually.
And what are the actual factors? I'm glad that you mentioned the factors. So what are the factors that influence
yeah, I guess the standard one that everyone that works with the microbiome will recommend you is to not use a lot of antibiotics. Always use antibiotics carefully. Never use antibiotics when you're just having the flu. Antibiotics can steer your microbiome, not only your urogenital tract microbiome, but can change your gut microbiome, your skin microbiome, and you might become in more troubles than before using antibiotics. Especially for vaginal microbiome, a major factor that can influence the microbiota, it's sexual activity. Stress is also a major factor. As for the rest of your body, stress affects your microbiome as well. Women should try to avoid vaginal douching. You should be more careful with the use of your tampons and sanitary pads. You should try to change it as soon as possible, not leave it for a long time, because that can cause a severe infection. Interesting, smoking can also affect your vaginal microbiome, so be careful and take this also into account. So these are, one of the major factors that can influence your bacteria and how they behave, and can change it from lactobacillus dominated to much more diverse and disease-orientated stage.
Okay, and what happens when one of these factors, or the combination of these factors, actually disturb the balance of the vaginal microbiome, and then there is not enough lactobacilli present in the vaginal microbiome? What happens then?
So like we said, the lactobacillus are dominant. So if they disappear, they leave place in the niche for the development, for the growth of other bacteria. One of the cases, it's the growth of anaerobes, a lot of anaerobes, which eventually can cause severe disease, can cause severe problems for the host. This this disorder is known as bacterial vaginosis, and it's characterized with overgrowth of bacterial anaerobes. So anaerobes are bacteria which don't need a lot of oxygen. In this case, the pH in the environment is very low because lactobacillus are not there to produce lactic acid, and a low pH, high pH provide the opportunity for other pathogens to start growing as well. Actually, BV, it's really a major issue, and I think around 21 million of the women in the United States experience BV annually. And 1 of 3 women around the world can have BV at a certain point of her life. So this is actually a major issue that most of the women don't know, and it can have severe consequences for your health.
And what are those consequences?
If BV is actually not treated, it's increased the risk of development of and acquisition of vaginal infections, such as different bacterial infections, or increase the risk of sexual transmitted infections, such as HIV or herpes or papillomavirus. If BV is not treated, can increase the risk of preterm birth. So pregnant women should take special care for themselves and should have regular checks with their gynecologist. Increase the risk of, if BV is not treated, can increase the risk of urinary tract infections, also something that women often suffer from, and it's not a pleasant thing to have. And finally, if BV is for a long time not treated, can increase the risk of infertility. And this is also not a nice thing to experience, I guess, and it's something that you should try to avoid. So there is a few symptoms of BV. Women can always follow them, and if they have some kind of discomfort, I would suggest you always go to your gynecologist and try all the opportunities to take care of ongoing infection on time.
Yes. So it looks like it's a pretty common issue among women, and very often I hear that these are occurring infections, and that's probably, these are those probably that are not treated properly, right?
Yeah, not treated properly, and actually it's bacterial vaginosis. It's not really an infection. Because around 50% of the women don't report any symptoms, so they actually don't know that there is something going on the, some kind of disease is going on, or some kind of disorder and dysbiosis going on. Because for some women, actually, it can be just a temporal shift in the vaginal microbiome. It's not per se development of dysbiosis or of severe infection. So for some women, it's really going asymptomatic. They don't experience any irritations or itchiness or smelly odor.
So what are the signs to look out for to make sure that we don't miss bacterial vaginosis?
This is one of the signs that I also mentioned, itchiness, irritation, fishy odor. Normally they characterize it with the smell of fish.
Is there a particular color? Maybe there is more excretions, or?
Yeah, it's like grayish white to yellow discharge, really depending from the infection. Some women report vaginal bleeding after sex, so it's really a few different type of symptoms that you can try to follow up. Okay.
So these are the symptoms they can look for and go to their doctor and see if they actually have a bacterial vaginosis.
Yeah.
Are there any other disorders that are associated with a disturbed vaginal microbiome?
Aerobic vaginitis, it's one of the severe diseases that can also develop in the vaginal niche. It's caused by aerobic bacteria. It's not well defined as a term in the field, but people are starting to recognize it more and more. I still feel that a lot of gynecologists just mistakenly say that it's a bacterial vaginosis.
Mm-hmm.
Symptoms are more or less the same, but the itchiness, it's supposed to be very strong, and the irritation in the niche, it's really unpleasant.
Okay.
So this is a common
This is
infection as well. Other common infections are candidosis caused by Candida albicans, although in these cases, the vaginal microbiome is not really disturbed. Candida, we still don't know why, but just can start overgrowing and cause a Candida infection, which is also very unpleasant and has the standard symptoms close to BV with itchiness, white, close to cottage cheese discharge. The smell is missing. It's mostly recognized by this cottage cheese discharge, white and creamy discharge.
So is the presence of Candida, because I think that's something that a lot of my followers are interested in. Is Candida albicans a part of the normal microbiome in vaginal microbiome or not? Or it's not supposed to be there when the microbiome is in a healthy state?
But everything is about balance. Even the BV bacteria are normally present in the vaginal niche. Just at a certain moment, they start overgrowth based on different factors. So to the best of my knowledge, Candida is also found in the niche. It's just there is many factors that keep the balance between health and disease. After smoking or during hormonal changes or all the factors we discussed, this balance can be very easily disrupted and the pathogen can start overgrowing over the beneficial bacteria. Then it's coming the problem because we lose the balance, the bacteria, the pathogenic bacteria or Candida become more, and it's more difficult for the lactobacillus to overcome the problem and to populate the niche again. So even BV bacteria, even Candida, they are present in a small amount in the niche, so they can easily overgrow under changing conditions.
So what would be the best way to treat these conditions? Because you know that antibiotics actually could be one of the reasons that cause these issues, right? By disturbing the microbiome and also especially vaginal microbiome. So, so what would be your thoughts on it? Are there ways maybe to populate the vaginal microbiome with lactobacilli rather than using another set of antibiotics?
It's good that you're pointing all of this. I wanted to jump into it myself. I've been working with probiotics, so you can always go for a probiotic solution because most of the probiotics are lactobacillus species. So it makes sense to use probiotic to treat kind of bacterial infections such as BV in the vaginal niche. I just have to make sure that everyone knows that you should go for probiotics which are well characterized, probiotics that are well studied and they have documented beneficial effects. There are such products on the market. I would always advise you to consult yourself with your doctor before start treating yourself just with random strains that you find in the pharmacy or in the general store. But you can use antibiotics. There is a lot of studies showing up that actually probiotics based on the composition of lactobacillus can treat and prevent development of BV. So they reduce definitely the recurrence of these infections. And they are beneficial generally for your health, so they can also have a great beneficial role maintaining a healthy vaginal microbiota.
So do you think probiotics, when we talk about probiotics, so there are some oral probiotics available on the market that are that have claims and that are clinically tested to actually help and benefit vaginal microbiome? Or do you think the locally inserted probiotics could actually work better?
Well, I think the science and the gynecologists that I talk in my field are a little bit split.
Mm-hmm.
In this opinion, some of them really prefer the oral probiotics, some of them prefer the local vaginal administration of probiotics. Um, like I said, as long as there is strong science behind the product, that the product is actually active and can promote women's health, I would suggest you to go for something like this. It doesn't matter whether it's an oral or a vaginal. You always need the advice of your gynecologist, and if you talk with your gynecologist clearly that you would like to go for a probiotic formulation, they should be able to provide you with the best that exists in your country. Because I don't know what is it in each of the countries around the world.
Yes.
But indeed, there is a few good studies showing that probiotics can help even when they are taken orally. They can find their way to the vaginal niche on natural pathways. And they can actually be traced after that, up to 20 days after you take an oral probiotic. It has been shown that they can be still found in the vaginal niche, not in your intestinal tract, but they can be found in the vaginal niche. So they do have a way to transit through the gut and pass in the vagina and provide benefits and try to cure ongoing infection. So I cannot advise you which one you should take. You can also go for a vaginal ones. Of course, they have their own benefits because you insert it locally. So probably it will be more effective at a certain moment. But as long as there is science behind the products, this is what you're looking for and this is what you want. You want well-defined probiotics products. You don't want just a mixture of strains that it's out there.
Yes, well-defined, clinically tested, right? Recorded. Yes, absolutely. That's what I usually also recommend because because we have this strain specificity, right? And the same lactobacillus species, but with a different strain designation can have totally different properties and might not just do what you expect it to do, right?
Yes, yeah. You have to choose the strains and the species that are best defined for the conditions that you're trying to cure or prevent or something in that sense.
Yes. Sure. Well, that was very interesting. Thank you so much. And I know we had a few questions from our closed group about maybe you can give us advice on what particular not detergent, but soaps women should use, and what soaps should be used for little girls to make sure we're not disturbing their microbiome, their vaginal microbiome.
Okay, that's a bit difficult question, but falls into all these factors that we talk that can influence your vaginal microbiome. So I think it's important to use more natural soaps, the one that don't affect the normal pH of your vaginal niche, because we said that the pH, it's mostly steered by lactobacillus and it's lower in the niche. So if you use a soap that increases the pH, you probably create a hostile environment for your lactobacillus. So this can change your vaginal microbiome, and it's better to use something which is more natural, that doesn't change really the pH in the environment.
Okay, so and also remember that it's not only soap, but there are so many other factors, right?
Yeah, there is always a lot of factors. It's not just the soap that you're using.
Absolutely.
Like the stress. Try to avoid stress. Nothing new, I guess. Handle, but still try to avoid stress. Try to avoid smoking. Try to avoid vaginal douching. Take hygiene for yourself. Change often tampons and sanitary pads. Yeah, I think this is the general things that you can try to help your vaginal microbiome to be in a healthy state.
Do you think it's a good idea to maybe on a everyday basis try and consume some sort of probiotics or maybe fermented foods, because we know that fermented foods are very rich in lactobacilli?
Actually, I should admit that I don't know. I think it's good to take probiotics and fermented food for your gut microbiome. But I don't think it's a good idea every day to use a capsule or something to
Mm-hmm.
boost vaginal health. I wouldn't do that. It's not common. I've never seen actually a gynecologist suggesting it. But
Mm-hmm.
yeah, for your good health, I would suggest you, if you can take fermented foods or if you can take probiotics, please do.
Mm-hmm.
They will only benefit you, it will never harm you.
Mm-hmm.
But for your vaginal microbiome, I don't think it's necessary.
Okay. Okay, thank you for sharing. And also, you mentioned at some point today that that some women can develop UTI infections
Yeah,
because of the bacterial vaginosis. So there must be definitely a connection, right?
yeah, sure. There should be some kind of connection. I think, oh, I will say this again. I think I said it already a few times, but scientists are not yet sure how things are all going on.
Mm-hmm.
In general, at a certain moment, we accept the vaginal niche as a reservoir for urogenital pathogens. So it's pretty common for women who has BV, ongoing
Mm-hmm.
bacterial vaginosis, to end up also with urogenital tract infection. So there is definitely some kind of a way of bacteria to transfer from the vagina to the bladder and cause really unpleasant urinary tract infections. So this is something we have observed, and it's something
Mm-hmm.
we try to study in more details.
Okay. So if there is a UTI infection, there probably there is a connection. So there may be also a bacterial dysbiosis and in vaginal microbiome too.
Um, yes, maybe vice versa. It's also possible.
Yeah.
I don't recall particularly a study I read it the
Uh-huh.
opposite way around, but yeah, opposite way.
There
It's
may
also
be.
possible, I guess. Yeah.
Mm-hmm. Yeah, there are a lot of information to think about. Thank you so much for sharing. And I know you have a lot more information with us to share about, especially women and and their babies' microbiomes, right? Because
That's
this is also the topic that I know my followers are very, very interested in. But I know we don't have that much time today to discuss all this information. But maybe a few words. Just briefly, can you tell us on how whether mom's vaginal microbiome is really that important for a baby that is born vaginally, and whether
yeah.
babies that are born via C-section actually may have a different microbiome because they didn't have this connection.
So we will just say a few words to tease
Mm-hmm.
your followers for our next video.
Mm-hmm.
Actually, yes, like I said, major issue with the premature baby is that the vaginal microbiome is unhealthy and it's
Mm-hmm.
DV characterized for a lot of women. So this is one of the important things we should take into consideration. And like you said, there is a huge difference in the development of your newborn baby, depending whether it's vaginally delivered or whether it's a C-section delivered. We know by now that vaginal delivered babies tend to have gastrointestinal microbiome and skin microbiome, which closely resemble the bacteria present in the vaginal tract of their mom. While C-section delivered baby tend to have a gut microbiome and skin microbiome, also oral microbiome, which closely resemble the skin microbiome of the mom as well as the hospital environment. So there is still a lot of ongoing studies in that field, but as for now, this C-section delivered babies microbiome seems to be low in diversity, and scientists extrapolate that it can lead to the development of serious disease conditions in the future, such as obesity, diabetes, asthma, and number of allergies. So there is clearly a difference when we talk for vaginally delivered babies and C-section babies. We don't want to shame any women that go for C-section, especially emergency C-section. Of course, you cannot do anything about it. You have to do it. But if you have a choice, maybe for the health of your baby, it's better to choose a vaginal delivery over the C-section.
Thank you, Mariya. Thank you so much. I really appreciate for finding time and coming today.
It's my
and
pleasure.
and I know we had so many technical difficulties, but thank you so much for your patience. And I'm sure there will be some questions in the comments. So I hope you will be able to address those in case if someone had a question and we didn't, we were not able to address it during our interview today.
Of course, I will be happy to answer all the questions that come up in the forum.
Okay.
And try to look at it and try to answer them. People can also follow me in Twitter, Facebook, my webpage as well, and ask all kind of questions they're interested.
Awesome.
To answer them.
Thank you. And what is your webpage? I know you will send me the link and I will post it also on Facebook. But could you?
It's MIP Consultancy, MIP/consultancy.com. It's coming from Microbiome Insights and Probiotic /consultancy. So everyone can follow me there and we can chit chat a bit more if they want to.
Wonderful. Thank you so much. And I know we discussed with you that we will have another interview where we will actually talk more about mom and baby's microbiome. So that will be another one coming soon, hopefully, right?
Yes, stay tuned about it.
Okay, thank you so much. Thank you everyone for listening and tuning in, and thank you for your patience too with our technical difficulties. Thank you so much, and we'll be back soon.